2021.
Well, thank you so much, and aloha to everybody who's there. I wish I was there with you in Hawaii, hopefully soon. And I put together a little presentation for today. Believe it or not, there's so much information that I want to share that you need a couple of days to really go through it all. So I've condensed it down, hopefully into a half hour. So wave at me if I go over, but I'm happy to share some of the basics as to why cannabis is medicine, what I've seen with patients, and the direction that I think that we're going as more and more people change their minds about this and decide to ignore the propaganda and look at the science. And, you know, it's interesting, yesterday I read an anecdote or I read a quote that said, if the anecdotal evidence or anecdotal reports don't meet or don't support what the science is showing. And remember, we have so much science showing that cannabis is bad for you, and that was directed 1970s, 1980s, and so on. Still today, doctors repeating this stuff, not realizing that there was an underlying agenda, and not even knowing about the endocannabinoid system at the time. But this quote said, if the anecdotes aren't the same as the science, you're obviously doing the science wrong. And I love that, because I know my patients aren't lying to me. I know that millions of people out there who are getting relief from cannabis are not lying. It's just not something that people who are suffering will do. They will tell you when it's not working. They will tell you when it is working. They will continue to use it if it's helping, and they will stop if it's not. And it's not any more difficult than that. So let me just get started here. And so just a little bit about me. I've been a California licensed physician for 30 plus years. I trained at Children's Hospital LA to be a pediatrician and was chief resident there. And then I kind of got the bug for critical care transport medicine, which I did, which was very exciting for a few years. And then I transitioned into pediatric emergency medicine, where I worked at the LA County USC Medical Center, very busy hospital. I did that for about 13, 14 years. And then in 2008, my eyes were open to cannabis. It wasn't really on my radar. A friend got sick, asked me about it. I didn't know anything, so I just did some research for her, and it completely blew my mind and made me realize that this is medicine. And I transitioned from emergency medicine work, which by the way is very hard when you're a mom also, to working in a cannabis clinic here in Los Angeles. And I just fell in love with the practice. And since then I've treated, our office has seen over 18,000 patients, including over 1,000 children, which is what I specialize in now. And then I wrote a book back in 2015 or 2016 and self-published it. And then it was picked up by a publisher and completely updated and revised just in the last year. And it came out at the end of September last year, called Cannabis is Medicine. And so in the book, I do try to just get rid of all the propaganda and just put what we know, what we've seen, what the science supports. Really, no frills, just all the data that you need to be able to make a decision as to whether or not cannabis is medicine. I think it is. As you all know, cannabis was used as medicine for thousands and thousands and thousands of years before it was made illegal. And we know in the 1840s, Dr. William O'Shaughnessy from the UK decided to use a scientific method to determine whether or not it was medicine. And he concluded that it was medicine in his scientific research. And between 1840 and 1900, there was over 100 medical reports documenting medical value. And by the way, if you're interested in seeing these reports, you can go to Google Scholar, and you'll see you can pick years, and you pick your years and put in either cannabinoid, you can put in ganja, you can put in hashish, all kinds of different terminology, and you can see these medical reports, and they're fascinating. There's a report of a doctor treating a baby with epilepsy from the 1800s, where he showed that the baby stopped having seizures. Amazing stuff. And then, as we know, cannabis was prescribed by doctors until 1937. And here's just some bottles that I always find interesting. And there are people out there who collect these bottles. I think it's terrific. I'd be so excited if I was at a a flea market or something and found one, I would pay whatever for it. But certainly we know that people use this for thousands and thousands of years as medicine. And then here comes along this nonsense. And as you can see, we have all this brainwashing. You know, I love this one with the devil and, you know, having their arms around your child. And certainly we know that this is still propagated by some people today. And it's really unfortunate because remember, at the time that this was put out into our world, they had no idea of the endocannabinoid system. They didn't know what THC was. It hadn't been identified. They didn't have any idea really even of how the human brain worked. And so it's nonsense. And I find it crazy that people still buy into this today. And as was mentioned in the last presentation by Theo, they were talking about cannabis being on the schedule. And as you can see, unfortunately, it is Schedule 1. And from my understanding and my opinion is that we do not move it to a Schedule 2 or Schedule 3. It needs to be descheduled. It doesn't fit the criteria for the Controlled Substance Act. It needs to be completely descheduled. We need to be allowed to do the research. And we also know that cannabis is so extraordinarily safe. And how do I know that? Well, 13 years of treating patients, I have yet to see anybody harmed by it, including young children who I have treated, you know, hundreds and hundreds of them under the age of 10 with high dose cannabis to either save their life from cancer or from epilepsy and, you know, 50 seizures a day. It is so safe. I'm a chicken. My husband jokes around, if you unzip me, there's a chicken inside. I'm very conservative physician. I'm very careful. I would not give medicine to a child that I wouldn't give to my own child. And certainly cannabis has no business at all being on the Controlled Substance Act, much less as a Schedule 1 substance. So hopefully we will see this soon. Hopefully there's somebody brave enough in the federal government to finally listen to what we're saying. So let's move on here. So if you look at this graph, what you can see is, and I got this from PubMed, and PubMed will show you from any articles if you search. So all I did was search medical cannabis, and these are the articles that came up. And I may have missed a few articles just because it wasn't, the search terms weren't applied to that. But what you can see is here, you can see that the research, it goes all the way back to 1840 because there are reports back then, and you can see a little blip around 1945, but notice the little blip in interest in the late 60s and early 70s, and that comes from research that was being done when the Controlled Substance Act was being formulated, and there were numerous studies that show that it shouldn't be there, but they disregarded it. And then you can see kind of the lull, and a lot of that lull over, you know, this area. I hope you can see my pointer here through this area here. This is all part of, you know, there's a few scientists interested. They're looking at data mostly in Israel and a few other places, but really no significant publications about the use of medical cannabis or its medical use. And that's because the Controlled Substance Act dictates that if it's a Schedule 1, you may study the detriment, but not the benefits. And we are still fighting that right now, even though the DEA says they're going to open it up. Hopefully we're making some movement. But as you can see, you're now seeing what happens over time. And when you look here around 2013, 2012, 2013 is when CBD starts to be mentioned in the media, and there's a documentary about a little girl with epilepsy, and sure enough, then the scientific world is paying attention and the articles explode. And as you can see last year, so remember 2021's not done yet. I assume it will be at least as much as 2020, but certainly 2020, there were a lot of articles published, maybe because people were home and productive because of COVID. They weren't sitting on the freeway in traffic. But we see a huge number of articles documenting medical cannabis. And luckily, the scientists and researchers and physicians are starting to pay attention. And as you can see, here's the highlights of the various important kind of times when we can see the research really changing. So in terms of major scientific discoveries, remember 1964 was when Dr. Meshulam, who's pictured here, was teaching, and he's a professor, a PhD in Israel, and he was curious about natural plant medicine and compounds. And in 1964, and believe me, this is probably not very easy to do because in 1964, we don't have great scientific equipment. But he discovered the compound that was the intoxicating compound. He isolated this compound out of cannabis and gave it to young, healthy volunteers who have the expected THC effects. He isolated CBD and gave it to young, healthy volunteers, and they didn't really feel anything. I'm assuming if they had given it to those of us in my age group with arthritis, we would have felt better. But in young, healthy volunteers, they didn't say that they had any of the intoxicating effects. So he discovered THC in the plant, named it, and for 24 years, we still lack the understanding of how it worked. And in 1988, researchers here in St. Louis, at medical school in St. Louis, discovered the first cannabinoid receptor. And in 1992, in 1992, they discovered the first endocannabinoid. So when they discovered the receptor, they realized that all receptors in our body, like we have serotonin receptors because we make serotonin. We have dopamine receptors because we make dopamine. Well, they discovered a cannabinoid receptor that binds to THC. Well, we must make a compound that binds. So they found our endocannabinoids in 1992, and that, just think of endocannabinoid as your inner cannabis molecules. And in 1995, scientists discovered the second endocannabinoid. And then within the scientific kind of researcher laboratories all over the country, the endocannabinoid system was kind of being looked at and studied, but it really didn't trickle down until, and remember, by the way, at the same time, I was in medical school from 1986 to 1990. I didn't learn about it. And remember, the AIDS epidemic hit around this time, and people that had HIV/AIDS were using cannabis illegally, and that was kind of the push, especially here in California. We have 1996, the Compassionate Use Act that gets voted in, and that's not an isolated event. It was because there was now some scientific proof that the endocannabinoid system regulated appetite and helped these poor patients with HIV/AIDS who were at that time had no other medications, at least to have some influence over their HIV wasting syndrome. Now let's talk quickly about the endocannabinoid system. So this is a system that the way to kind of think about it is it's a feedback loop, and it's a system that is meant to balance you. So in this picture, we have a neuron here, that's a nerve, a brain cell, and we have a neuron down here, another brain cell, and they're communicating with each other by sending neurotransmitters, and the neurotransmitter gets released from this cell and heads down and binds to a receptor like a key in a lock on the receiving cell. So let's say the message that's being sent is a message of nausea. When this binds on, then this cell then transmits that same message. When I was in medical school, I learned that cells only talk to each other in a one-way street fashion. This cell talks to this cell and there's no feedback. And it turns out that the endocannabinoid system is that feedback loop. So if the message of nausea is being sent, usually it's when there's too much message. So when you think about nausea, anxiety, pain, hyperactivity, seizures, it's all overfiring. It's like too much message. What's supposed to happen is this bottom cell, the receiving cell, gets annoyed, turns on a little factory, taking healthy fats from your diet. Oh, by the way, remember doctors 30 years ago told us not to eat healthy fat or fat at all. So that's part of the problem too. But it takes healthy fat and puts it together and makes your inner cannabis compounds, what we call endogenous or endocannabinoids, which then travel backwards, opposite of what I was taught. The key in the lock, the little inner cannabis compound, binds to the receptor, which is this funny looking structure right here on the cell wall. sends a chemical message, and this kind of non-arrow here, this block, is basically telling the neurotransmitters, dial it back. So if you've ever seen anybody with severe nausea and vomiting from chemotherapy, they take a puff off a joint and within minutes, they are feeling better. And in fact, they're able to eat a whole meal. How does that happen? Well, this receptor also accepts THC, attaching to it, binding to it, the same way our inner cannabis does. And what we know is that people who have chronic stress, chronic illness, an overwhelming event, that sometimes the endocannabinoid system cannot keep up. But understand, the most important thing is this is a signaling system that functions to balance the cellular messages that are being sent. So again, what is the role? Is homeostasis, balance. So when we have a trigger like an illness, infection, inflammation, traumatic insult, even something like chemotherapy, anything that causes that imbalance where the body is saying, oh my goodness, let's counteract this, the endocannabinoid system goes into action, protecting, repairing, and recovering. And I'm sorry, that's I have a little defect or a little mistake there, but I apologize for that. Phytocannabinoids like THC, CBD, CBG, etc., all can influence the endocannabinoid system. They can also influence what we call non-endocannabinoid system targets. The endocannabinoid system doesn't exist in a vacuum. It crosses over with a lot of the other compounds and pathways in our body. So it's important to understand that we're not only targeting the endocannabinoid system, we're also targeting non-endocannabinoid system. And all of that leads to protecting, repairing, and recovering. So by using cannabis, you are augmenting your endocannabinoid system. And there are times when you might not want to do that, but certainly in face of chronic illness, people who are having any type of illness, infection, insult that causes anxiety, pain, appetite issues, sleep issues. These are all things that are balanced by the endocannabinoid system. So once the endocannabinoid system was discovered, these receptors were discovered, scientists decided to map where they are. Why does cannabis help? Everything is varied as cancer, fibromyalgia, sleep disorders, epilepsy, pain that you have in your toe. How is it possible that cannabis can treat so many things? Well, look at where the receptors are. They're everywhere. They have a density in your brain, in your gut, in your immune system, but also it is the most widespread receptor system in the brain. And this is what drives me crazy as a physician, is that like 95% of doctors ignore the fact that you even have an endocannabinoid system, because if they acknowledge it, then they have to acknowledge medical cannabis. And unfortunately, we're still, medical schools aren't teaching this, but I call all of us here today enlightened. And we're enlightened to the idea that our body has all of these receptors and that we can use this plant as a wonderful tool for health. Why wouldn't we take advantage of the fact that these receptors are everywhere in our brain and body? All right, in 2003, my friend Ethan Russo, who is what I call a medical cannabis guru, he hypothesized the idea of an endocannabinoid deficiency. So what if you don't make enough endocannabinoids when you have a trigger? How are you supposed to respond? And he hypothesized that people who have migraines, fibromyalgia, irritable bowel, but also what he calls treatment-resistant conditions. I know everybody listening knows somebody, or maybe yourself, suffering from chronic illness. Go to 10 different doctors, try 50 different medications, and they cannot seem to find the solution. And so I always tell people two things: diet and cannabis. You got to think about those two things. And what are both of those things? Natural, Mother Nature, right? So we have to be understanding that there can be this glitch in your chemistry where you may not make enough endocannabinoids, but you may be able to achieve an endocannabinoid homeostasis by augmenting the system. And so he outlines, and I highly recommend, there's a few articles with a similar title because it evolved over time. But this concept is similar to other human chemical deficiencies. So if you don't have dopamine, you have Parkinson's disease. If you don't have insulin, you have type 1 diabetes. And if you don't have acetylcholine, you may have Alzheimer's dementia. What are the drugs, the pharmaceuticals that we give to people who have these conditions is to fix the chemical deficiency, or at least augment it as best we can. Since Dr. Russo posited that idea back in 2003, so here we are going almost 20 years, a deficiency or dysfunction of the endocannabinoid system has been implicated, and all of this information comes from the scientific literature in all of these different conditions. And again, how can it possibly be so many conditions? Well, remember, these receptors are in many places in your brain and body. So anything related to, anorexia, obesity, metabolic syndrome, FTT is failure to thrive, which is a condition in children, but also can be in adults. Anxiety, depression, so mood disorders, autism, autoimmune disorders, and again, the triad that Dr. Russo outlined: migraine, fibromyalgia, irritable bowel, epilepsy, schizophrenia, chronic motion sickness, PTSD, and more. It's almost hard to keep up, which is very exciting that there are scientists dedicating their life to researching the role and the manipulation of the endocannabinoid system to try to impact human health in a positive way. Now let's talk about the plant. And so we know the plant has over 500 different natural compounds. Over 140 phytocannabinoids have been described. Of course, the two most famous compounds or most studied compounds are THC and CBD. We also know there's terpenoids and flavonoids, and so many other compounds in the plant that we don't even really know a lot about, again, because research has been prohibited. But what we know about the plant is that there is this idea of the entourage effect, which some people still doubt. But yet there's research, very recent research coming out showing that this idea actually does exist. And what is the entourage? Is that each of these compounds has their own medicinal properties. But when taken separately versus taken in the natural form, what we would call full spectrum, broad spectrum, along with all the other compounds, not removing it out and isolating it, but taking it along with the way Mother Nature gives it to us in the flower. As you can see, there's a female flower here, that it actually works better. You have a decrease in unwanted effects and an enhancement of the desired effects. And so that's a very important concept. And in my experience, there's no question in my clinical experience that I see entourage working very well for many patients. And of course, the picture here is just a close-up. The middle picture is a close-up of the flower with its trichomes, and those are the little factories where cannabinoids are synthesized. And then the picture to the right just shows the 3-ring, 21 carbon basic skeleton of most cannabinoids. And as you can see, they all kind of look very similar. And many of them overlap in their medicinal properties, and many have some singular medicinal properties. It's quite fascinating. Here is a schematic of how the plant actually makes all the different cannabinoids. So remember, there's raw cannabinoids. When you have the raw flower, you're going to have CBGA, which is the parent precursor to all of the other cannabinoids. And depending on the genetics of the plant, you're going to see different expression of enzymes that convert CBGA, cannabigerolic acid, to various compounds. And it's kind of like your genes determine your eye color in your hair. So your genes for the plant's genes determine which way it's going to go. And of course, that can be manipulated by breeding and some other methods. But what we see here is, remember, in the raw form, A at the end. And when I first started in this field back in 2008, we did not think that the raw forms had any benefits whatsoever. And I had this patient that came in that told me he ate raw cannabis, and I thought he was nuts. But he said it helped him with his inflammation. He was a bodybuilder, and he said if he didn't do it, he had tremendous pain after working out. And if he did do it, he felt great. And so I thought, okay, whatever works. Lo and behold, the studies certainly support the anti-inflammatory nature of raw cannabinoids, as well as other things that they do, including anti-epilepsy, anti-cancer, and so on. We know humans heat up cannabis. And so when you heat it up, you cleave off 1 carbon and 2 oxygens in a process called decarboxylation. And then we get these compounds, THC, CBD, and so on. And then as cannabis ages, you also get a whole slew of compounds as well. And then I put a list here of compounds that I actually have treated patients with. When I started in this field, all we had was Delta-9 THC. That's it, take it or leave it. It either worked for you or it didn't. And then in 2012, CBD started to become available here in California. And then slowly, it just, every time you turned around, there was a new compound on the market. So the main ones that I use mostly, Delta-9 THC, THCA a lot, CBD, CBDA, and CBG. CBC is just now available, and I'm starting to use that in some patients. CBDV was available for a short time here in California, but I haven't, I think the grower stopped growing it. Delta-8 THC is now kind of in the news. It's like the new CBD media attention getter. And what's amazing is that now a patient, if THC didn't work for you or you didn't like the way it made you feel, you've got so many other options. My goodness, the plant is what Dr. Meshulam called it, which is a virtual treasure trove of medicines. Now, everybody knows about terpenes. They're essential oils found in the plant. There's over 2,000 that have been identified, but 200 have been described in the cannabis plant. We know terpenes give cannabis its aroma and occurs across species, and they work synergistically to enhance medicinal effects. The terpenes are very important. There are patients, when a patient says, I like this strain and not that strain, that's not because of let's say the THC is equal in both. It's because of the effects of the terpenes. And again, that entourage effect and that synergistic balance that you get when you make sure to keep those terpenes present. Now, in terms of adult conditions, we know, my goodness, so many different conditions, but in my practice, which right now I focus on children, but I've seen so many adults, this is kind of the order in which I've seen people. So chronic pain by far number one, and then other psychiatric, number two, psychiatric disorders like anxiety, depression. But remember, chronic pain comes with this. A lot of people who never had depression before have it because they have chronic pain that's not being treated properly. Sleep disorders for sure is a very large one that we see. And I have to say that I ask every single patient about sleep, and they all, about 90+% will say that cannabis helps with sleep. And then you can see the rest of the list: cancer, autoimmune, GI disorders, neurodegenerative, traumatic brain injury, spinal cord, and palliative care, end of life. In pediatrics, very similar: treatment-resistant epilepsy, autism, cancer, genetic syndromes, CP and spasticity, and then some of the psychiatric stuff, and then chronic pain, which luckily is not that common in pediatric. And then, of course, very sadly, end-of-life care. And then I just throw in here, I just want to share with you this. I got this text message, and in the picture here where he's a little guy, where sporting his little faux hawk there, was the first day he came to see me, and he was this beautiful little boy, was having seizures on his EEG just about every minute, and he had never responded to any medication. And the super sad thing was he has a brother, an uncle, who is completely debilitated from the similar condition. And when they came to see me, the mother said, I cannot have my son end up like my brother. I need to find something that works. And he's been my patient now. We're going on 6 or 7 years at this point. He's like this big, huge teenager now. You can see the picture down at the bottom with his new little baby brother. And the mom sent me this beautiful kind of reminder, 5 years seizure-free today. So how that is not, how doctors look at this and say, it's still not a medicine, I don't understand. I'll just never understand it. It has completely changed this child's life and has allowed him to develop normally without seizures interfering with his brain function. And so I have 2 minutes and I've got 2 case reports, and then we'll wrap up. So this is the story about a little boy that came to me. So he was 5 when he came to me, 6 years old now, and he had 3 strokes right when he was born, and nobody knows why. And he ended up having cerebral palsy, seizures, sensory processing disorder. When he came to me, he had self-harming behavior, poor attention, and speech delay. I think he had a few words, no, yes, but only in response to what his parents would say to him. He never had spontaneous speech. So we started CBD low dose and slowly tiptoed up. And I will say that his parents were a little bit nervous. Most parents are. And he had improved speech and cognition. There was clear-cut improvement. We added THCA next, but he became drowsy even at a tiny dose. So we discontinued that, left the CBD on board, and then we added CBG. In my population of patients with autism, I've been observing improved speech in about 30%. So for those families that want to see if we can attempt an improvement in speech, we always try CBG. And now he has spontaneous speech, putting 3 and 4 words together, and much better focus, and also improved motor skills. And what's interesting is the therapists that work with him on a regular basis have been pointing out to the mom these incredible leaps of achievement in his therapy, and they don't even know that he's on cannabis, as far as I know. So that's also a very nice testimonials when people who don't know notice the difference in the child. And then this is from an email. Additionally, he started drinking from his own straw cup completely independently. He could previously drink from a straw, but this time he's holding the cup, drinking, putting it down until he's ready for more. And he started to try to self-feed with a fork, even telling us no when we try to help. And that's good. We want children to have an opinion and to share with us what they're thinking, right? We're so pleased with all the progress he's made over the past couple of weeks, and he's really proud of himself too. So this is obviously a success story, and certainly can show you that we can try to reverse some of these, especially in a brain that's plastic in young people. And I say young people, I mean even into their 20s. I have a patient who I've been following since teenager into 20s who's still showing improvement despite years of brain damage from seizures. So we don't give up on anybody. We try, and certainly with a safe medicine. But this shows you that this really can change the prognosis, not just symptoms today, but prognosis for this child. And then I want to just kind of go to the other end of life, to an 87-year-old man that I've been helping who has dementia. He's been having dementia now for a number of years, requiring full-time care, severe anxiety, uncooperative, poor appetite, poor sleep, agitated, difficult to calm down, terrible response to medications. And he stopped smiling and laughing, and that seemed to really bother his family. Because of where they live and what they had access to, we started with a 10-to-1 ratio. That was easily accessible by the daughter, who happens to be an RN. And we start low dose and titrate it up, and we got up to about 50 milligrams of CBD a day. And we didn't notice, he was definitely calmer, but we didn't notice any benefit at a higher dose. So we dialed it to 50 milligram twice a day. And then we added in low dose THC to kind of get down, lower that ratio, and titrated up very small amounts, little by little. The tremor, the sleep, the appetite, all significantly improved at just a very low dose added in of THC, 2.5 milligrams 3 times a day. And here's the email. Dad is doing so much better. He's calm and pleasant again, and we've now been able to wean him off Haldol. He's able to tell us his needs and wants now. For instance, he has to go for a walk to the lake yesterday, which he hasn't done in months. He's sleeping through the night, although here and there he has a bad night. We give extra THC when this happens, and it seems to work well. One more thing, my mom and I think it's most important. He started smiling again after 4 years of no smiles or laughing. We're so happy with his results. Anybody who wants to deny somebody this at the end of life is cruel and inhumane. This is medicine, and it needs to be free to be medicine. And that is why I'm here to proclaim and try to get rid of all that propaganda and stereotypes and everything else. These are just everyday people. These are our family members. These are our neighbors. These are the children of our community. There is absolutely no reason that we need to act like this is radioactive plutonium. It's medicine. Thank you very much.
We're wishing you well, Kane, if you're watching from the hospital today. And Kane has a GoFundMe page. We'll share that information towards the end. Thank you again, Dr. Bonni. Really appreciate it.
My pleasure. Someone had a question. Can I answer it real quick?
Of course.
It's in there. It says, do I have a particular concern regarding hemp-derived Delta-8 synthesized from CBD precursor? i.e. uncharacterized isomers, et cetera. And so remember, you can get delta-8 from the plant itself, or you can take CBD and put it through a process called acid catalysis and turn it into delta-8 THC. But from my understanding from the chemists that I often consult in my world, that doing that acid catalysis and converting CBD to delta-8 THC can give you some kind of leftover compounds that have not been characterized, that we don't know what they are. And I think it's prudent to, at this point, not necessarily put that stuff into your body until we know exactly what it is. I think delta-8 THC is an excellent compound for those people who really don't like the effects of delta-9, because it works the same way, it's just not nearly as potent. So people who are are sensitive to delta-9 THC, they have a kind of like a lower level to use. And so, yes, I am concerned about that. And I am encouraging people to try to avoid CBD that's been altered from hemp.
Great. When is there like any time frames you think, are people doing some good delta-8 research right now, or is that?
You know, it's a great question. I don't know who's doing research right now. I think the industry kind of got a hold of it and is doing their thing. So I would be curious to know. And look, I love the garden and I love gardening, but I'm not nearly the cultivator that I would want to be. And so I don't really know really if you can do this, which is to, breed the plant to be higher in delta-8 than delta-9, I'm not sure. Or can you just work with it and pull out the delta-8 in a lab from, whole plant, good old fashioned, THC dominant cannabis. So I'd be curious to know, from a cultivator in terms of that respect. Yeah.
Great.
Do you want me to continue to answer the questions, or do you want to go through them, or?
If you could take a couple more,
Just a couple more? Sure, I'll be real quick.
Yeah,
sure.
Thank you.
So someone asked about autism protocol. So I try to individualize my treatment plans. I try not to do cookie cutter, because remember, autism is a spectrum disorder, and there's kids that have all their little individual things. So there's a study out of Israel that showed that around 50% of kids will respond to a high ratio CBD THC preparation, and the rest need more THC. It's 50-50. I do find that the kids that have more aggression, self-injurious behavior, terrible sleep, hyperactivity, I'll go a little more THC heavy. The kids that don't seem to have that, I'll kind of go a little more CBD heavy, but also I use THCA, which has some terrific effects, which I can't necessarily explain, because THC hasn't really been studied. Is it the little bit of THC in there? Is it the terpenes? It's hard to know. So I don't necessarily have a protocol on autism. Again, it depends on the child, but again, kind of I explained THC versus CBD and THCA. Someone asked me if where I'm located. I'm in Los Angeles. When people say, do I work with extracts, not whole plants, each molecule is extracted? No, I have my patients going into dispensaries and buying whole plant. Now, remember, in pediatrics, you want to use tinctures. They're gummies and all of that kind of stuff. You want to be able to start very low dose and titrate up. So it's whole plant extracts is what we're talking about that I'm using in patients. Someone asked negative allosteric regulation of CBD on the CB1 receptor. Great question. So this is, and I didn't include the slide, but let me just explain. Here's your receptor. Here's THC that comes along and sticks to what we call the orthosteric site, a specific landing site. There's also a site over here, let's say, where CBD attaches. That's called the allosteric site. When CBD attaches, it kind of changes the shape of the receptor, and it changes how tightly THC binds to the receptor. And so it can modulate the effects. It can help reduce some of the unwanted effects. And again, it depends on how much CBD and how much THC. I find 1-to-1, 2-to-1 ratios, 2 parts CBD, 1 part THC. You're going to feel the THC. It's not enough CBD to counteract. but it can minimize like paranoia, anxiety, for some people, munchies, for some people, racing heart. And for some people, they just need that higher amount of CBD with that little bit of THC, stimulate the receptor, but not really feel the effects of that. So it just kind of depends. I hope that answers the question, Amy. Thank you. Is the PowerPoint available to share? I can make it available to share. And then, have you encountered any studies on cannabinoids on COVID? Yes, there's a handful of studies on COVID. Now, nobody's done a clinical experiment yet, but in animals and in test tube, what you have to understand, why do people die from COVID? They're not dying necessarily from COVID itself. They're dying from the effects of COVID, which is cytokine storm, what's called like an over-release of all your pro-inflammatory chemicals in your body. And what do we know about cannabinoids? They're potent anti-inflammatories. There was a study before COVID. I just shared, this is my last statement, I promise. In 2015, a group at the University of South Carolina, of all places, where there is a wonderful researcher who studies the effects of cannabinoids on inflammation. He took mice and gave them an infection that we know causes cytokine storm, that massive release of pro-inflammatory chemicals that can kill you. He gave those mice no treatment, and after 5 days, 100% of the mice were dead. He took other mice and he gave them the infection and then treated them with THC for 4 days. And on day 5, all the mice were alive. 100% mortality to 100% survival with the intervention of THC. And this was in 2015, before COVID even hit. And I just wanted to say, I reached out to him at the beginning of COVID and I said, why don't we do a clinical trial? And he said, if you can believe this, okay, I have the email to prove it. The physicians in his hospital were worried about the patients getting high. And I thought, let's see, a death from COVID versus the intoxication. I mean, like, it just totally ridiculous. So that is how deep the propaganda is in the medical community. So that is why I'm out here talking about it, because I'm over it. It's time to move on.
Thank you.
Okay, thank you very much.
Thank you so much, Dr. Bonni.